Did you know that after heart disease and cancer, the next biggest killer in the United States is not respiratory disease, it isn't car accidents, and it isn't stroke? It's medical errors. We're talking about 250,000 lives every year. As a nurse, I've seen the cracks in the system. Today, I'm going to tell you why this is happening and, more importantly, how you can protect yourself or a loved one in the hospital. When most people hear medical error, they tend to think of a bad doctor or a negligent nurse. But most of the time, it's rarely that simple. It's a systemic failure. Errors happen when staff are exhausted and stretched thin. You know, hospitals often prioritize risk management over transparency, and they don't really talk about the errors that often happen in a hospital, and lots of times they're even covered up. I've known nurses that have made an error or a mistake and never even reported it because of the backlash that they would get. They would take 100% of the blame rather than a failed hospital safeguard like with the EMARs. Y'all, I apologize for the sun, but Bertha is visiting us here today in Tallahassee, and so the sun is in and out. But I wanted to bring this to you guys because the numbers are absolutely staggering. I mean, 250,000 plus deaths in the United States every year due to the medical errors. And it's not going to get any better until systemically there's a correction. And I just don't know that the hospital administrators and all of the financiers, I think is how you say that word, are concerned about it, because right now I just don't think that they are. You know, there's often a lot of pressure to bury the errors that happen, the errors that are reported. And, you know, lots of times it's what they call a near miss. And, you know, I've had this happen to myself. You know, I was a travel nurse, and I was in an ER, not an ER, but a hospital as a travel nurse. And it just seemed that the floor I was on was in disarray, like the supply room was in disarray. Nothing was where it was supposed to be. And I had been asked to go get a bag of normal saline really quickly. And so I went into the supply room, found the bin that said normal saline, and grabbed a bag. So when I got to the room and I went to spike the bag, I realized that the bag I got was not normal saline. It was D50. And, you know, that could have really hurt the patient. But, you know, I didn't say anything. I just went and got a new bag. And, you know, I guess some people would say you probably should have reported that. But, I mean, I caught it. But you think about how many times things like that don't get caught and a patient is given the wrong medication. But as a patient, you're not powerless. So I want to share with you how you can protect yourself. So anytime that a doctor or a nurse gives you a medication or starts an IV, don't be afraid to ask what it's for, what the medication is, why are they giving it to you, what the dosage is. And also know that lots of times when you are admitted into the hospital, your allergies from previous admissions or even your doctor don't always get transferred into your chart for that admission. So just make sure that you ask or let your nurse or your doctor know that, hey, I have this allergy to this medication, or any of its derivatives in the medication that you're about to give me because I'm allergic. You know, don't be afraid to say anything or ask questions. Like, you may take a generic pill at home, but at the hospital, they're going to give you the brand name of that medication, and they may look different. And so don't be afraid to say, hey, you know, I don't recognize this pill. What is it? And anytime a nurse comes into your room to give you a medication, they are supposed to ask you your name and your birth date, even if it's the 4th or 5th time that they have been in your room that day. And I know it may seem redundant, but you have to understand that they're taking care of a lot of patients, and it's usually not a safe number. You know, and they can have different patients' medications laid out at once as they're doing a med pass. And, you know, just ask questions. If they don't ask you your name or your birth date, say, whose medication is that? Why are you giving it to me? Because even when I was in the hospital, I had medications that were, number one, given to me, narcotics. And I even had another nurse ask me if I wanted my PRN pain meds when I actually didn't have any scheduled or any orders on my chart for those medications. So always ask. Another thing that you can do is have a family member or a close friend go with you to the hospital and have someone up there with you as often as you can. Lots of times they can take the notes for you, or may even think of questions that may not come to you in that moment, especially if you're not feeling well, if you're on pain medication or something that causes you not to think clearly. You'll have someone there who can ask those important questions and advocate on your behalf. They may see subtle changes in you that need to be addressed quickly with a nurse or physician that you may not be able to verbalize. And so it's always important to have someone with you at the hospital. And don't forget to follow your gut. If your gut is telling you that there's something that's not right, or if you're second guessing what's going on, don't be afraid to say, I want to hold off on this until I speak with my physician. Because lots of times that gut feeling is there for a reason, and it's, you know, it's good not to ignore it. Even if it turns out that you're wrong, it's better to be on the safe side. And don't forget, if you are scheduled to have a surgery done, ask to speak to your doctor before going into surgery, before they begin giving you the medications. And just have a conversation with him and question him. I mean, it's, you know, it is your right to ask questions and advocate for yourself, because this is your body that they are working on. Feel free to ask them, okay, what procedure are we doing today? What body part are we doing it on? And I know lots of times they will come to your room. Sorry, guys. They will come to your room and, you know, they'll, you know, take a, what they call a skin marker, and they will, let's say they're going to do a right knee replacement, and they'll make sure that they mark the correct knee, and then on the other knee, they'll put not this one or something of that nature. So, you know, just advocate for yourself, ask the questions, ask to speak to the doctor before surgery and before any drugs are given, so that you can be aware enough that you can hold a conversation with him. This is your, you know, this is your life. You know, lots of times surgeons have a God complex, and, you know, they want to go in and they don't want to use their machines. I'll get it out in a minute. I'll give you a, for instance, so my mother-in-law had gone into the hospital to have a heart cath done. And what they were going to do is they were going to insert a balloon into one of her arteries and blow that balloon up to try to open up that artery. And per protocol, they're supposed to use a visual guide. And so they set the machine to blow the balloon up to a certain size. And he's supposed to use the visual guide to ensure that he goes into the correct artery. Well, this surgeon, this cardiac surgeon, didn't do that. And the artery that he went into was too small for the balloon. And when he blew the balloon up, he burst the artery and she bled to death internally. And so it's things like that that are called medical errors, and it costs lives every single year. Machines. The healthcare system is broken in a lot of ways, but you can be the one to help keep a loved one safe when they're in the hospital. Let me know down in the comments if you have suffered a near miss while you were in the hospital or something of that nature, and let's discuss it down in the comments, and I will see you guys on the next one. Bye, y'all.